Hi. Today I'm just going to go through some things to help release your face, your jaw, and your neck. These are areas that tend to get tense for most of us when we're kind of overthinking or when we're stressed. And I think with the addition of the current day of having to wear masks, some of us can hold a lot of tension in our jaw from that. And of course, all the tension in our jaw from the stress on top of that. This is especially good for people who have to wear masks all day long, like the KN95s or the N95s, healthcare workers and the like. I notice with wearing it, I get a little tense up here as well. So I've been doing these myself. So basically, I'm gonna talk you through some myofascial techniques. I'm only gonna show them for just 30 seconds or so, but when you do this, pause between each technique and hold each of these for about 3 to 5 minutes, or until you really feel like your whole system kind of relaxes. So once you get into the hold, maintain it, relax your body, and allow the release to happen. Okay? So the first one is more of just sort of a warm-up. I would say spend about a minute and then do this 3 times. So this first one is just to kind of get the traps to release. So you're just going to reach back to your shoulders. You're going to let your hands sink down into the tissue. And that takes about 20-30 seconds to really sink in. So if you picture your body like it's made of clay, it's how you take the time to let your hands kind of sink in as if you're making a handprint or a handprint on the sand or the snow, depending on where you live. So just settle your body, let the hands sink in, and then once you're sunk in there, without sliding on the skin, just sort of pull the tissue forward. If you have lotion on or oil on, this is harder to do. You're going to slide more, but you're still going to get good effects just from even if you do end up gliding over the skin. Eventually, you may start gliding over whatever layer you're on, will start gliding over another layer. So go ahead and pull forward until your hands come all the way forward to your collarbones. Again, this might take longer than what I'm showing, but I'm just kind of giving you the motion. So reaching back, sinking in, pulling forward. Those are the steps. So I would do that one 3 times. Next one is just going to sweep the neck down and then allow your hands to rest onto your chest. On the skin, head goes down. Again, allow your hands to sink into the sternum. So you're making contact with the sternum. For 30 seconds or so to let it sink, and then pull the whole complex of the skin and the sternum down towards your waist. I usually start this one looking down a little bit. And you're going to feel the stretch through here. It usually goes even up through the sides, up into the back of the neck. And then after you feel it sort of start to release, you can start to slowly curl your chin up. So you're going to kind of tuck it back, curl it up, and then reach up with the chin until you feel a stretch. Okay, and once you find your position, again, 3 to 5 minutes, you can allow it to go a little bit left, a little bit right. And just spend a good, a couple minutes in each spot. Okay, when you come out, slowly bring your head back to neutral, release the hands slowly. Okay, next one is going to release your temporal bones. So what you're going to do is you're going to grab the ear. You got little handles here. This tissue is going to go inside your head. It's going to reach inside the head. The temporal bones are triangular, and the tissue around your sinuses is what you're getting into. It's also the T part of TMJ, so it's going to release the jaw. So this is the one I really used a lot lately. It's like the anti-mask remedy because the mask kind of pulls my ears a little bit forward. So you're going to grab onto those ears. You're going to pull out, down, and back. until you find resistance. And then you're gonna hold it. Now with this, it's really easy to start getting tense through your shoulders, so I do recommend leaning your elbows on the table or onto your lap so you can really let yourself release into this. So it's out till you feel resistance, down towards your shoulders till you feel resistance, and back towards the back of your head, and then hold that. Really hang out with this, and it's not a brute movement. It's a pretty subtle movement, but you'll feel that stretch. And your job with all of these techniques is just to feel it. And the more you feel it, the more it will start to release and heal. So just whatever sensation you're feeling. Okay, so hold that for another few minutes. All right. Next one we're gonna do is the bridge of the nose. So you're gonna pinch that little bone right where the eyes meet. I find that using 2 fingers on the sides of the nose this way can work really nicely because I can relax my shoulders more. So you're gonna again sink in towards that nose bone, and then you're gonna slowly, without sliding on the skin, pull that area up and away. This is for if you've got that little clip on your masks. I find this gets a little bit tense and it can kind of cause some pressure into the eyes. And again, I've put some moisturizer on before this, so I'm sliding a little bit. You want to do this without the moisturizer. And because we're touching the face, just a reminder, make sure your hands are clean. Wash them before you do this. Okay? All right. And we're gonna get into the jaw. I'm gonna show the external jaw release, and then I'm gonna show an internal jaw release. You'll wanna wash your hands before you go inside your mouth. When I do this on my patients, obviously I wear gloves. You can wear gloves too if you'd like. So the external one, you're gonna take your hands and you're gonna put the palm of your hands on your jawbone. So it's gonna look like you're surprised or oh no. So you're just gonna take where your jawbones are, you're gonna sink in, it's called your mandible, to the sides of the jaw, kind of making a little squishy face. And then once you sink in, you're gonna pull again down towards your waist. This is so good for anyone who has TMJ problems, or if you grind your teeth at night. This is a really great release. The last 3 we've done, the ear pull, I guess we did the nose in between, but the ear pull, the jaw pull, and the internal release for the jaw are probably the 3 jaw-related ones I would do for TMJ. And then, of course, releasing the base of the skull and the neck, which I'll show in another video. Okay, so you do that again 3 to 5 minutes. And then the final one, we'll pretend I washed my hands. I did wash them before I started. You're gonna take your finger. I'm gonna use my index, but you can use your pinky if you've got a real small jaw. Basically, we're aiming right here inside the mouth, so right to that joint right there. So you're gonna go behind the teeth, up into there, until you find a tender spot. It's pretty much always tender, no matter if you've got TMJ problems or not. If you do have TMJ problems, it's more tender. So, right there, you can see my finger a little. And you're gonna press in towards the joint and then out just slightly, like a slight, tiny little pull out towards your cheek. Okay? You're gonna hold that again, 3 to 5 minutes. Other side, 3 to 5 minutes. All right. So I hope that these little techniques help release any jaw tension you have, and I hope you have a beautiful day.